have come to the conclusion that by the close of July, if they do not get the collective agreement implemented, they would have cause to strike again. How does that sound to you?
Okay. Not very palatable, but they have their rights. They've exercised a lot of patience. And I think government is equally working hard to see how you can meet them, their demands. What is interesting and very comforting is that at least we were supposed to meet yesterday, but due to circumstances beyond the powers of the ministers and some stakeholders, they were unavoidably absent in the country. So they understood the excuse, but are insisting that they still need us to meet the conditions of service that we agreed upon to implement this year to be implemented. The good thing is that at least they came down. They chose some 4 important items to them that we should try. The government should try and implement them. And the government said they were going to analyze it and then do some studies to see how feasible it can be done. And the response was to be given yesterday.
Right.
So our only hope and we pray that the government will come out with a positive response to that effect, so that at least the threat that they are giving to us for July may not take place in that way. We will save the country, we will save Ghanaians a lot from the hassle of lack of nurses in our hospitals. That will lead to a shutdown of our hospitals. So, though it's not a very good news to we consumers of hospital services, right. But we can't say anything. It is their right to demand for conditions of service, which we all agree. The only challenge that we all know and that has been told.
Doc, your line is breaking. You would have to kindly reposition yourself so we can hear you.
As I was saying, they have demanded for certain things to be done. So let's pray that government is able to find fiscal space to accommodate the 4 demands that they have made, so that it will prevent the shutting down of our hospitals. That is what I wanted to say.
I see. Right. Well, I'll have you hold on so I can talk to Big Uncle, Mr. Austin Gami, who's a labor consultant. Chief, good morning. Thank you for your time.
Good morning, Johnny.
Yes, sir. So now it looks as if all things go well as agreed at the table, it means that we will be out of the woods and the nurses would not have to go on strike. They have given until the end of July. Is the timeline okay from where you sit?
Well, I appreciate their challenges. If I were to be in their shoes, and I am unaware about what it takes to be negotiating with an employer, I may say the same thing they have said. But I think that they've done well, except that they could have said they look forward to a healthy negotiation with the employer to resolve the matter without necessarily threatening, the citizenry again. Putting everybody on a knife edge that come July ending, if we are unable to resolve the matter, then we are back to square one. That's my only worry. But if we are right to ask for whatever is due them, nobody faults them, except that we have to abide by rules and procedures and humanity at stake. That is the reason why it is not every company, including your media outlets, that have been declared and placed on essential service. The reason why they put them on essential service is known to them. I've once upon a time told them that it is better they look for an enhanced salary levels than asking for mushroom of allowances, because allowances do not take people on to retirement. Well, today I'm sure that thing should be handling them by now. So it's important that we all, not just the nurses, the entire nation, we have to take a holistic look at wage levels and performance-related wage levels, people being paid based on productivity.
Right.
Yesterday, the whole night, I've been studying and putting things in order against these kind of things. So I'm not against them. I'm very happy for them. Good, they have given a long rope up to July ending, but the threat aspect of it, they know I'm not a fan of it.
I see. Doc, I come to you now. Your government says that they are trying to reset, trying to pick up the crumbs, trying to put it together so that at least you can deliver the public good. And then you are hit with this demand at this time. Do you have something in the purse or in the coffers to be able to cushion the nurses and the midwives at this time, looking at our financial position?
Johnny, thank you. I think you know the state of the finances of this country. And I think you know very well, deep in your heart, and the nurses, I think most of them know very well, deep in their heart, that if the government had money available to give to them, the government wouldn't have blinked a second. Money would have been pumped out to fulfill all their demands that they have given to it. So I think what we have to do is we continue to persuade them to the best of our ability, to really consider their service. Like Senior Osingami said, consider their service as essential. And for that matter, going on strike will lead to devastating consequences to the lives of Ghanaians in the country. But I also add that I support the call Osingami is making, and I've said it elsewhere before. Let's really look at services that are called essential services and have a flat, similar conditions of service for all of them, and let all those employed in those sectors, before you even take off office, you sign a bond, just like the military, just like the police, just like any other essential service, not to ever attempt to go on strike. But we also have to work to meet their conditions of service and make their salaries in a way that they will never attempt to go on strike. That is what I think that in the future, that is what we should be looking at. Giving them a good salary and giving them good conditions at their service place to really make them service so that they don't go on strike. That is what I believe we should be doing. But for now, I'll say that once government has money, they should not be thinking otherwise. Government would give it to them. Just that actually the fiscal space has been so squeezed in a way that we all understand that it's going to be difficult to get money. A lot of institutions, state-owned enterprises are in serious debt, are in serious crisis. Where to mobilize and draw money and give it to them was a challenge. And it's a challenge, and government has explained that. So I pray and I hope that the finance minister and his team at least will try to bring a positive response for them for what we have agreed, and whatever it is, they should actually should not be threatening us again with the strike. They should come, like Mr. Osingame said, with a statement that would comfort us. We thank them so far for the patience they've had, and we pray that they will continue having that patience with government and Ghanaians. Once they have patience with government, they are having it with Ghanaians, because their services goes directly to Ghanaians.
Mr. Game, so the section of the Ghanaian populace who've been engaging me say that, look, each time you have either doctors or nurses or anesthetists or lab people or people within the health sector go on strike, most likely people lose their lives, and we saw that when they went on strike not so long ago. Now they're asking me, do they get their full salary for the month of June, even though they were away from work and people lost their lives? Who compensates the people for that? Whose taxes are used to pay them anyway?
Well, I appreciate the moral part of the question. It's also legal that if you don't work, you don't get paid. But we have linked with a certain poor management tradition in Ghana here, whereby when people go on strike, they are paid. in other civilized jurisdictions, when you go on strike, that is your choice. And so you don't get rewarded for going on strike. But here in Ghana, since it forms part of the negotiation, that when you are on strike and we are negotiating, is good, and therefore you should be paid. Our law. Our law is very, very clear. You cannot even threaten or take attempt during the course and after. And there's something that negotiation is before, during, and after. The implementation period of any collective agreement can be stopped, and the parties that sat and wrote that into a collective agreement can be called upon to come and take a second look. That is why we have what we call flexibility aspect of labor relations. But in Ghana and Africa, especially Ghana, we are so fixated with status quo. What we know and we do is what we practice and glorify. And I'm so embarrassed sometimes living in this country and these things happen. And when my friends ask me from outside, why have they not consulted you? Have they spoken to you? Then I didn't know what to say again. So I think that is most inappropriate to pay people that way. But because we have lived with it as part of our status quo, we continue. But I'm hoping that we will have the courage to speak about it as a nation and to establish the fact that it's inappropriate. It's already part of our law. You don't get paid when you don't work.
I see. Dr. Anabak, let me come to you now and ask you the posture of the Health Committee in Parliament, and then the fact that the ministers responsible for finance and health were not in the country at the time when the meeting was supposed to have happened. The nurses say that is a show of bad faith. Where do you stand?
Oh, no. They know very well that after we, the committee, we are in to negotiate to find a solution to the impasse between the two groups, government and then the nurses. The reason why the minister is not around, I think it's very important that he leaves the country to go and look for that very resources that we are looking to compensate them or fulfill their demands. So I don't think that the minister did this in bad faith. The ministers didn't do this in bad faith. We all know where they've gone. They moved with the president. They've moved to other financial institutions in the world to see how they can put the image of Ghana, the status of Ghana at a better position to allow us to get inflows. That would go a long way to finding the monies to pay them. So this was, to us, it is not done in bad faith. They did it in good faith, and it was necessary for them to move out of Ghana to see how they can negotiate to help Ghana get some funding, right? So I will beg the nurses to understand the importance of the absence of the minister to all Ghanaians, and today the nurses. It is very important for the country for them to move out. So they should still have that patience and still have that compassion and have the faith that something would materialize for them. Right.
Doc, you have worked within the health sector before. You've actually managed one of our state health facilities before. This book and research allowance that we're talking about, lecturers at the universities demanded, now nurses are demanding, their fair share of their book and research allowance. But do we really have every single nurse buying books to research, and for which we have to give them allowance for that?
Johnny, let me make a correction. The book and research allowance, in fact, is not for all the nurses. It's for the tutors of the nursing training institutions.
Right.
It's not meant for all nurses. It's for a few group of them. I think they are about, they are not, I don't think they're even up to 5,000.
But that was not made clear. So the impression out there in the public domain is that every single nurse is going to get. That's why I'm asking you so that you can give us the explanation.
Every single nurse is not going to get book and research allowance. It's only meant for those who are into the nursing training colleges, who are tutors of the place, to research and be able to teach modern nursing, so that they are able to upgrade their knowledge and impact better lectures to their students. So it is not meant for all of them. Likewise, there was some fuel allowance, which is not really meant for all of them. It's meant for some category of nurses that are going to get. What was common to them is the 8% and the uniform. 8% in the uniform. And they were asking for what we call the retention fees, whereby when they are going to renew their license, they expected government to pay for it. But some of us have told them privately and told them that, look, after that, every professional in this country renews his license with his own money. You don't expect government to renew everybody's license for him. Then it means that we should just allow everybody to be practicing without renewing the license. But that one was a personal thing that they had to do themselves.
I said that and I was insulted mercilessly. So I asked, for example, that if the architects and engineers at AESL also come forward, the HR practitioners come forward to say, start paying for our licensure or whatever it is, renew it for the lawyers and everybody. Can we afford it? I asked that simple question. Nobody answered. It was insult that I got.
Right. As for that, we some of us made them to understand. Besides that, most of the classes they go, though, the CPDs, continuous professional development courses they do, some of them are even handled by the states, by the training colleges, by the institutions that help in those training. And virtually we don't pay for them. People, sometimes organizations sponsor those things. So it's just for you to pay a fee to believe that you have renewed your license and be proud of yourself that you have renewed your license. And that is what everybody is doing. So that one, I think, has gone low. They are not talking much about it. And I hope that it will remain like that. For the book and research allowance, it's for just a few group of them, people in the nursing fraternity that will benefit from it. Likewise, the forward. So the 8% of the basic, and then the uniform that they are demanding. The uniform too, they are demanding for an increment. It was 400 or so, and we have to top it up because of price fluctuation or inflation. The government is to top it up to take it to 1,000. That is what they are demanding for. Honestly speaking, look, condition of service is good, but like I would agree with my senior of Ngame, getting a better wage and establishing a condition of service for all essential services in Ghana that should look similar, with little variation, and bonding people to essential service, no strike, would be the best solution for us to move.
I hear you. So, Big Uncle, let me ask you, they're also demanding for a 13th month allowance. First of all, guide us through where the 13th month allowance concept came from and how it works. We want to learn.
I think something happened some 2 years ago or so, and out of desperation or something, the then government agreed to some 13th months. It was not intended to be a permanent thing per se, because 13th month is like paying some form of bonus, some kind of bonus to people. It would have been ideal, but this is a government exchequer, and it's not like a private sector where proper things are done and accounted for. I think some of the institutions were asked to pay at the institutional level through their IGF. It's all money. So I don't think it's something that they will be necessarily fighting tooth and nail for, because it was not intended at the time to be a permanent thing. That's one. But look, let me be very clear here. I think this country needs to wake up from its sleep. We have to pay people well, but pay people based on productivity and the setting that it can be sustained. Otherwise, you can agree to whatever you want to agree to. You pay it a while, and that will be the end. You cannot sustain it. It's very dangerous for everybody. So I want to appeal to my friends who have been working with many, many years to try and tone down a little bit. And if you take example about that comment that the Minister of Health and the Minister of Finance traveling is considered as though the nurses matter is not important. I feel very sad about hearing that. I am not working directly with them, but I'm part of the country. I live here. And therefore, I do know exactly why the Minister of Health and others have to accompany the President in Brussels. They know it, that as part of their work, according to the Labour Act, when a nurse is employed and is assigned to go and work somewhere, he needed raw materials, he needed materials, machinery, tools, and equipment to work with. In Brussels, they are negotiating for diverse medical facilities to be brought to this country also, for the nurses to use to enhance their work. I know exactly where the Minister of Finance is today, because as a labor consultant, people ask me a lot of things, so I'm at their breast. I know that he's looking for, the country went through a certain mess, we all knew that, and they have to restructure our banking situation with other countries. Where the finance minister is, some of us know. Everybody who cares to know. And so saying that you are discouraging them also for doing their work, you are trying to say that they should stay in the country, whether they would get the money, restructure, do whatever they want to do, it's immaterial. It's not fair. You don't say such things in public domain. You know, they are somewhere working for Ghana. And the Minister of Health and other officers whom I know accompanied the president to Brussels, and we all followed on various networks how the president went there and did, and he's in the company of the minister. They should be proud that their minister is part of the team. So what is it that we haven't known and haven't seen before? So coming publicly to say that it means they don't care about them, I felt very sad. If I were to be the normal self with them, and I can go to their place, I would have told them, look, apologize to them for what you have said.
I beg, Uncle, are you suggesting, for example, that the leadership are trying to pitch the nurses against the ministers of finance and health? Is that what you see?
That is how it will be understood by many of us, because the point is that the Minister of Finance, I sent a message asking them. I didn't know they traveled initially, but I wrote to them and asking, when are you going to have meeting with the nurses? And the feedback I got from the Minister of Finance promptly was that I am in this location negotiating for this banking situation we found ourselves in, and I'll be back in the country. But I'm sure maybe my colleagues will engage them. So and then I met the Minister of Health too, and he told me, look, he was traveling to Brussels. He was going to try to look for something for their own common good, and indeed, and now he is now virtually like a victim of circumstances for doing his work. And they should have known, and the leadership of the nation should have known. You know, so I'm not happy that this has been said the way they have said it. It is just saying that, well, they have not been able to meet us. We look forward to having a meeting with them when they return from their journey. Fine. But to say they don't care about you, it was too loud and clear, a kind of attack on their personality of insensitivity. That's how it felt.
Mr. Gami, I want to thank you very much indeed for your time this morning. We're grateful that you spent your morning with us. Grateful. That's Austin Gami of Gami and Gami Associates, and is a labor consultant. Dr. Anaba, you have the closing thoughts. So now we know where we are, but where do we go from here? Cover this.
Yes, let me add to what Austin Gami just said about the absence of the ministers.
Right.
I know the health minister went with the president to meet Gavi, that supplies vaccines across the world to countries that are in need, and they went there to negotiate and to see how they can get vaccines for this country. We all know the importance of vaccines, and I think the nation leadership knew very well where the minister had gone. I think that they should have really tempered their words of they don't care about us, because that is caring for all Ghanaians, including the nurses. Going to get vaccines for Ghana, get money to get vaccines for Ghana, was also equally very, very important to the entire country. If we don't have vaccines, we know what will happen. What I'll say is that the nurses should continue having the patience and have hope that once the ministers come back, we'll hear something positive from them. Even at all, if they don't meet all their demands, they should still understand that we are resetting, and the reset requires a lot of resources to meet everybody's demand, and that cannot be done in a twinkle of an eye. One other thing I would say is that, look, the 13th month salary issues, health workers also look at other institutions, and that is where we have to also tackle other institutions that are dissipating the country's resources in giving people allowances that they don't deserve. You can see companies that are running at losses, government-owned companies running at loss, and giving end-of-year bonuses. Government should ensure that those things stop. If you are a CSO or you are a state-owned institution, enterprise, and you run at a loss, no board member should be given a dime. You do that, you are provoking other people. And I think we have to stop that. That one, because they look at all those things and make their demands. Why is somebody at Cocoa Board, which is making a loss and getting bonus at the end of the year? Why is somebody at ECG making a loss and getting bonus at the end of the year? So they are also demanding. They are bringing all those demands from other state institutions that are running at loss and getting bonuses. So they demand for 13 months a salary as an allowance. Meanwhile, they are really hardworking people. So let's really look at it. But in fact, no hospital can bear the burden of paying 13 months salary. When you check, no hospital. Those who attempted couldn't do it the second year. It means that we have to really look at that and actually enhance salary to avoid paying 13 months salary to anybody. Or else we'll run the hospitals down, they'll use their money to buy drugs and other things and pay 13 months salary, and there wouldn't be anything to work with. That is what I would say. And I'll still beg on the nurses to temper justice with mercy and have compassion and understand the situation of the country, and let's move forward, and hopefully their issues will be resolved in the shortest possible time. Thank you, Johnny.
How do we compensate for the lives that were lost while the nurses were on strike, and do we pay them for the days that they were off work?
With that, I would say my condolences to all families who lost their loved ones. And then this should be a lesson to us to really design a pathway of really paying people what they deserve and putting people at the places that they deserve so that we avoid going on strike. That is it.
Was that part of the considerations that the Health Committee in Parliament had in mind before agreeing to some of the demands that the nurses had made?
Definitely. People losing their lives and people not getting the needed health care, getting complications out of their diseases, is a worry to us. We considered all those things, because one person loses his life just because a nurse is not in the hospital is one life too much to bear. So definitely, people losing their lives, people not getting care was a big concern to us. And we were appealing to them because the health sector is a sector that works with compassion, just like they've had that compassion and gone back. They went back because of compassion, because of the love for the people. And I hope they'll continue to work for the love of the people till government gets the needed resources to meet their demands.
So should we deduct the number of days that they were away from work from what we're going to pay them for the month of June? You have been head of a public health institution before. You are a practicing medical doctor. I want a direct answer from you.
We have antecedents and we have precedents. And the precedents in Ghana is that when people go on strike, whether they are health workers or whatever, they still get their money. Until we come out to implement any law that says that anybody on strike should not get money, it is the union that should pay them, like in the UK, like in the US, like in any other country, that when you go on strike, there is the union which is to pay you. We can't change it. It's unfortunate. Because they have always enjoyed, and we have always enjoyed salaries even though we are on strike. What for do?
Dr. Anaba, I thank you very much indeed for your time. He's Member of Parliament for Garu and a Member of Parliament's Health Committee. We're grateful that you shared your morning with us. Thank you, Doc.
Thank you, Johnny.
Great. And then we will get into our galamsey and tree planting conversation in a bit. But first, let this music sip in.